Osteoporosis is a condition that causes your bones to become thinner, weaker, and more brittle. According to the International Osteoporosis Foundation, it affects 21.2% of women over the age of 50 and 6.3% of men over the same age worldwide. Although your bones are very strong, they are made up of living tissue that is constantly breaking down and rebuilding. Until your early 20s, your body has the ability to make new bone faster than it can break down old bone tissue. But this process slows down as you get older. As you age, old bone tissue can break down faster than it was formed. This can cause your bones to become more porous and brittle, leading to osteoporosis, which can increase your risk of bone fractures. Knowing the symptoms and risk factors can help keep your bones strong throughout your life. In this video, we will learn about the symptoms of osteoporosis and risk factors, as well as how to treat osteoporosis and more, so watch the video until the end. Symptoms of osteoporosis. Treating osteoporosis in its early stages is the best way to prevent some of the more serious consequences, such as bone fractures or bone pain. So what kinds of symptoms should you be on the lookout for, and when do they develop? Let's take a closer look at what is known about the symptoms of osteoporosis in the early and late stages. Signs and symptoms of osteoporosis in its early stages. Detectable early signs of bone loss are rare. People often don't know they have weak bones until they break a hip, wrist, or other bone. However, certain signs and symptoms can indicate possible bone loss, such as gum recession. Your gums can recede if your jaw is losing bone. Ask your dentist to check for bone loss in the jaw. Weaker grip strength. In a study of postmenopausal women and overall bone mineral density, researchers found that lower hand grip strength was associated with lower bone mineral density. In addition, low grip strength can increase the risk of falling. Weak and brittle nails. Nail strength can indicate bone health. But you should also consider other factors that may affect your nails, such as exposure to very cold or very hot temperatures, regular use of nail polish remover or acrylic nails, or immersion in water for long periods of time. Other than changes in bone density, osteoporosis does not usually cause many initial symptoms. Your best bet for detecting it in the early stages is to talk to your doctor or healthcare professional, especially if you have a family history of osteoporosis. Signs and symptoms of later stage osteoporosis. Once your bone mass deteriorates further, you may start to experience more noticeable symptoms, such as height loss. Compression fractures can cause the spine to become shorter. This is one of the most obvious symptoms of osteoporosis. Fracture from falling. A fracture is one of the most common signs of osteoporosis. Fractures can occur with a fall or from a slight movement such as stepping off a pavement. Some osteoporotic fractures can even be caused by severe sneezing or coughing. Back or neck pain. Osteoporosis can cause compression fractures in the spine. These fractures can be very painful because the collapsed vertebrae may press on the nerves emerging from the spinal cord. Pain symptoms can range from mild tenderness to debilitating pain. Bent or broken position. The pressure of the vertebrae may also cause a slight curve in the upper back. A hunched back is known as kyphosis, which can cause back and neck pain. It can also affect breathing due to the extra pressure on your airway and the limited expansion of your lungs. What are the risk factors for osteoporosis? Both men and women can develop osteoporosis, but this condition is more common in women because it is often caused by hormonal shifts that occur with age. Common risk factors for osteoporosis include the elderly. Go through menopause before the age of 45. Removal of the ovaries before the age of 45. Low testosterone in men. Low estrogen in women. Take some medications that reduce hormone levels. Smoking cigarettes. Having a family history of osteoporosis. Frequent drinking of alcohol. Not getting enough regular physical activity, especially weight-bearing exercises such as walking. According to a reliable research source, osteoporosis is more prevalent among white people and people of Asian descent, more specifically women. Certain medical conditions may also increase the risk of osteoporosis. These include kidney failure, vitamin D deficiency, diabetes, hyperthyroidism, rheumatoid arthritis, dementia, history of breast cancer, cystic fibrosis, sickle cell disease, malabsorption due to inflammatory bowel disease or celiac disease. How can osteoporosis be diagnosed? Your doctor may detect osteoporosis by measuring your bone density. A machine called dual-energy X-ray absorptiometry, or DXA, can scan your hip and spine to determine how dense your bones are compared to other people of your gender and age. The DXA scan is the primary diagnostic method. The test takes 10 to 15 minutes. Another type of imaging study that doctors may use to diagnose or confirm a diagnosis of osteoarthritis involves the use of ultrasound, usually of a person's heel. What are the complications of osteoporosis? Osteoporosis can increase the risk of bone fractures, especially wrist, spine, or hip fractures. According to the International Osteoporosis Foundation, 1 in 3 women and 1 in 5 men, over the age of 50, will suffer an osteoporotic fracture. The effects of vertebral fractures can cause a person to become shorter because these fractures can shorten the spine. In some cases, bone fractures may require surgery. According to reliable research, bone fractures can increase your risk of disability or death. Hip fractures, in particular, are associated with a 15 to 20% increase in mortality in a year, especially among men. Osteoporosis can also cause bone pain that can affect your ability to perform daily activities. How do you treat osteoporosis? Treatment for osteoporosis includes medications to help build bone mass. These medications often have hormonal effects, stimulating or acting like estrogen in the body to encourage bone growth. Examples of medications used to treat osteoporosis include bisphosphonates, calcitonin, estrogen, parathyroid hormone, PTH, such as teriparatide, parathyroid hormone-binding proteins, such as abaloparatide, raloxifene Evista. But consult your doctor before taking these medications. Can you prevent osteoporosis? It is important to take action to prevent bone loss and maintain bone density. Examples of bone-building steps you can take include: get involved in sports. Regular weight-bearing exercises help build bone mass. Weight-bearing exercises involve a physical activity that you do on your feet, with your weight supported by your bones. Eat enough calcium. An adult typically needs about 1,000 milligrams, mg, of calcium daily, according to the National Institutes of Health. However, this may vary based on stage of life and calcium needs. Calcium-rich foods include low-fat dairy products, canned sardines and salmon, broccoli, beans or legumes, collard greens, cabbage, fortified foods such as bread, cereal, and almond milk. For specific information about your calcium needs, speak with a healthcare professional. Get enough vitamin D. Get vitamin D on a daily basis. Vitamin D is necessary to help your body absorb calcium. Most people need 400 IU of vitamin D daily. Exposure to sunlight between 10 and 15 minutes can stimulate vitamin D production. Spending this limited time in the sun 2 to 3 times a week while wearing sunscreen is enough to meet your vitamin D needs, according to the Skin Cancer Foundation. Foods such as fortified milk, egg yolks, and salmon also contain vitamin D. Osteoporosis is a condition that causes your bones to become thinner and more brittle. Because your body's ability to make new bones slows as you age, osteoporosis is more common among the elderly. Although osteoporosis is more common in women, it can also affect men. Symptoms of osteoporosis usually do not appear. You may not know you have this condition until you break a bone. However, Some signs and symptoms, such as receding gums, poor grip strength, and brittle nails may be early warning signs. Loss of height, hunched posture, back or neck pain, and bone fractures are often the most common symptoms of a later stage of osteoporosis. If you have any of these symptoms, be sure to make an appointment with your doctor. They can diagnose osteoporosis with the help of certain tests and develop an appropriate treatment plan for you. If you benefited from this video, subscribe to the channel and share the video on social media platforms. Our goal is to improve your health.